My name is Patti, and I've been diagnosed with CIDP. Throughout my adult life, I have had issues with feeling unwell or tired or constantly run down. It was after the birth of my children, though, when my journey to diagnosis of CIDP began. I went to the doctor because I knew something was wrong, and I was more or less dismissed. So I continued my search until I finally found a neurologist. Finally, after I received a positive result on a nerve biopsy that there was a demyelinating process going on, I received my CIDP diagnosis. At that point, the doctors decided to start me on IVIG. I did that for 6 years. IVIG was not optimal for me. I think the worst thing for me was trying to get my veins to cooperate. It would take 5 to 7 sticks before I could get an IV started. I then had to just sit on the couch and hope that I didn't lose the vein. The weekend before my son was supposed to get married, I just got this wave of fatigue and exhaustion and weakness that just took me down. I went back to the doctor and I said, something is still really wrong. He mentioned the dreaded thing that I had been avoiding my whole diagnosis, and that was the port. Personally, I feel like the port is very invasive, and I wanted that to be like a last-ditch effort because to me it was a daily reminder that I am dealing with a chronic illness. I did a search online, and up popped an article about Hizentra. And I was so excited immediately after reading the article and seeing that it was an option, where I could infuse it myself. I went to the Hizentra website and printed out the doctor discussion guide, took it back to my doctor and told him, I said, I would like to consider this. We had the discussion and he agreed that it was a good fit for me.
Important safety information. Warning: thrombosis, blood clots, can occur with immune globulin products, including Hizentra. If you are at high risk of blood clots, your doctor will prescribe Hizentra at the minimum dose and infusion rate practicable and will monitor for signs of clotting events and hyperviscosity. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation and the full prescribing information for complete boxed warning. Hizentra, immune globulin subcutaneous, human, 20% liquid, is a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. See full prescribing information, including boxed warning, as well as important safety information at the end of this video or at Hizentra.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.
Hizentra has made a difference for me. It has given me the flexibility to know that I can take care of myself. That was really huge for me. I first heard about prefilled syringes in a patient discussion group. I was totally intrigued by the possibilities. When I started my treatment with Hizentra, I encountered issues with trying to draw the medication from the vials. Drawing and pulling it can sometimes take a lot of exertion. And there were times when I'd actually have to have my husband help me. Prefilled syringes takes that exertion away. The very first time I used the prefilled syringe, I connected my transfer device. And when I went to push the prefilled syringe, it was like, wow, that was quick. It was really quite, as silly as it sounds, it was exhilarating because I could do it. I could do it myself. It gave me that independence. And That independence made me feel empowered in my own health care. For me, to get to diagnosis and finding Hizentra, it was like a huge turnaround in my life. I feel more like me than I did in the last 35 years of my life. So at this point, to be here and now, again, I've been given a lot of gifts, and I think this is another one.
Important safety information. Warning. Thrombosis, blood clots, can occur with immune globulin products, including Hizentra. Risk factors can include advanced age, prolonged immobilization, a history of blood clotting or hyperviscosity, blood thickness, use of estrogens, installed vascular catheters, and cardiovascular risk factors. If you are at high risk of blood clots, your doctor will prescribe Hizentra at the minimum dose and infusion rate practicable and will monitor for signs of clotting events and hyperviscosity. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation and the full prescribing information for complete boxed warning. Hizentra, immune globulin subcutaneous, human, 20% liquid, is a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Treatment with Hizentra might not be possible if your doctor determines you have hyperprolinemia, too much proline in the blood, or are IgA deficient with antibodies to IgA and a history of hypersensitivity. Tell your doctor if you have previously had a severe allergic reaction, including anaphylaxis, to the administration of human immune globulin. Tell your doctor right away, or go to the emergency room if you have hives, trouble breathing, wheezing, dizziness, or fainting. These could be signs of a bad allergic reaction. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. Inform your physician if you are pregnant or nursing or plan to become pregnant. Infuse Hizentra under your skin only. Do not inject into a blood vessel. Self-administer Hizentra only after having been taught to do so by your doctor or other healthcare professional and having received dosing instructions for treating your condition. Immediately report to your physician any of the following symptoms, which could be signs of serious adverse reactions to Hizentra: reduced urination, sudden weight gain, or swelling in your legs, possible signs of a kidney problem, pain and/or swelling or discoloration of an arm or leg, unexplained shortness of breath, chest pain or discomfort that worsens on deep breathing, unexplained rapid pulse, or numbness or weakness on one side of the body, possible signs of a blood clot, bad headache with nausea, vomiting, stiff neck, fever, and sensitivity to light, possible signs of meningitis, brown or red urine, rapid heart rate, yellowing of the skin or eyes, chest pains or breathing trouble, fever over 100 degrees Fahrenheit, possible symptoms of other conditions that require prompt treatment. Hizentra is made from human blood. The risk of transmission of infectious agents, including viruses and, theoretically, the Creutzfeldt-Jakob disease, CJD agent, and its variant, VCJD, cannot be completely eliminated. The most common side effects in the clinical trials for Hizentra include redness, swelling, itching and/or bruising at the infusion site, headache, chest, joint, or back pain, diarrhea, tiredness, cough, rash, itching, fever, nausea, and vomiting. These are not the only side effects possible. Tell your doctor about any side effect that bothers you or does not go away. Before receiving any vaccine, tell immunizing physician if you have had recent therapy with Hizentra, as effectiveness of the vaccine could be compromised. Please see full prescribing information for Hizentra, including boxed warning and the patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.